Hi, I'm Kelly Biggs. I currently am working in the intensive care unit at Duke Raleigh Hospital, and I'm often a charge nurse, the rounding nurse, and I actually precept as well in the unit. I currently have an associate's degree from Pitt Community College, and I am in school at UNCW online to receive my bachelor's degree and should complete that by the end of next year, December 2018. And I'm very excited to be here and interviewing for this position.
Okay, so tell me a little bit about yourself and why you feel you are qualified for this management.
So I really think that I'm qualified for this position because I've already kind of taken on some leadership and small management opportunities already. Like I said, I'm the charge unit often very often on my unit, and that entails me not only orchestrating patient care and patients that can be downgraded and moved out of the ICU, but also ones that need to come into the ICU, and also making sure that we have enough staff and that our shifts are covered, putting people on call or calling people in, floating people to other units if they needed to be, and so working with other units helps that as well. I also work on the schedule, so I'm the night shift scheduler, and that's a lot of work in itself, making sure that everybody is trying to be as happy as they can, getting the shifts that they want, enough of the weekend shifts and not too many of the weekend shifts, and then also making sure that we have enough employees to cover how many patients we have in the unit as well. Then we also have a wide variety of nurses, different skill levels. We have new grads and we have ICU nurses that have been ICU nurses for 20 years. So trying to make sure that the staffing for one particular night doesn't have all new grads, so they have the variety of people to actually help each other out and not, be an all new team there. And then, like I said, I'm the rounder, which is the rapid response team nurse. So with that position, I actually follow all the patients in the hospital. I monitor their vital signs, and I'm a resource for the floor nurses. If they are uncomfortable about the way their patient's looking or they're having difficulty speaking with the physicians, I actually work with that nurse and work with the physician. And if the patient needs escalation of care, I get that patient moved to a different unit. And then the main goal is to try to prevent rapid responses or codes outside of the intensive care unit. I really feel that I'm a big problem solver. I love to look for solutions strategically, and I'm professional, and I like to really encourage the team to value each other. Like I said, we have a lot of different people from different areas, different walks of life that have worked different units. So we all have our own experiences that we bring to the unit, and it's very important for us to value each other and make sure that we are accepting of one another. And then I always try to model the expectations. So as the charge nurse in the unit, I try to make sure that I am presenting myself in the way that I feel like the team should be presenting themselves and doing things appropriately and following procedures and protocols and just modeling those expectations for my colleagues. Okay.
What is your style of leadership? And what style do you prefer your supervisors to display and why?
So I would say that my leadership style is more on the democratic style. And I'm trying to develop more into the transformational characteristics as well. I feel that it's very important to provide structure without being overbearing and without, telling everybody what to do. So trying to make sure that, you're getting your point across, but you're actually encouraging the person to think for themselves as well. I really think that employees should be involved in the decision making for the unit. Our unit currently has a unit practice council that I'm involved in, and all the staff members work together, our managers and nurses and nurse aides all work together to solve problems for the unit, whether it be materials or issues with the waiting room for our patients' families, anything that kind of comes up, that's what our unit practice council does. So it's really nice to actually have the entire unit involved and not just it being handed down. And that's kind of what I really enjoy management wise. Like, it's not a dictatorship and it's not authoritarian. They're not telling us exactly what to do all the time. I try to really motivate the team and my colleagues by knowing what their goals are. So like I said, we have some new grads coming in, so making sure that they're feeling comfortable and they're learning and they're going to some of our critical care courses that we actually provide at Duke, and learning from our physicians and learning from some of our other colleagues. Then we also have some nurses that are trying to move forward to get their CCRN certification or their stroke certification. So making sure that they're encouraged to meet those goals, and I feel that's very important for our management team to do. So it not only helps them achieve their goals, but in the long run, it also helps them meet the vision and the mission of our actual unit in the hospital as well. And it's really, really important to build a team on trust. If your team doesn't have trust, and if the team doesn't trust their leaders, they don't feel supported, they don't feel encouraged, then it's going to fall apart and crumble in the long run. You've got to feel like you have encouragement and that you are backed up from your management team.
Describe core values that are most important. Describe core values that are most important to you and why.
So my core values. So just to kind of pick my top two, I would say family and integrity. Family has always been very important to me. It's kind of helped drive me as I've grown as an adult. They've obviously helped mold me into the person that I am today. They always encourage me. They've provided me with an unfiltered view on actions that I do, and they're bluntly honest with me, and they tell me things that I may not want to hear, but I need to hear. And they're always there for you in times of need or times of joy or times of sadness. They're always there by your side, helping to encourage you or to be a shoulder to cry on if you need. And keeping family in mind, it's very important when you're caring for patients to not only just take care of the patient, but take care of their family as well. A lot of times patients come into the intensive care unit and it was an unexpected event. And the patient may not really be aware of what's going on because they're sedated, but the family is there and they are watching their loved one struggle to live and, come into terms with the fact that they might actually even possibly die. So, making sure that we are being there for that family member or the entire family, how many ever are there, so that's very important to me. Having integrity is very vital, especially in the healthcare system, especially also in management positions, because being honest and having the personal drive to hold yourself responsible for your own ethical and moral standards is extremely important as a manager, extremely important to anyone, really, it should be, but especially in a management position. Some other core values that are really important to me are having appreciation for others. You need to really be able to appreciate other people and appreciate what they bring to the table. Being committed, which shows loyalty and lets others know that they can count on you to be there. I'm really a big advocate of if you say you're going to do something, then you need to do it and step up and take that responsibility for that decision you made. Being compassionate regardless of who it is, whether different gender, different sex, religion, culture, just really being compassionate to other people and their views and their ways of life. And then having patience is very important. Having patience and being respectful helps improve productivity, and it shows validation to others, and helps build their self-esteem as well, which is really, really important.
Give an example of a model of care that you believe is effective in delivering high-quality, fiscal, responsible care.
So I kind of first want to think about what model of care means to me. So a model of care helps define how health services are delivered. So it's important to create an outline of best practices for a specific patient population, and as they progress through that condition. So, what a neuro unit is going to be different. What a neuro unit needs is going to be different from what a cardiac unit needs, and what those different patients are going to need to heal and get better and succeed and move to rehab or be able to go home. So the goal is to ensure that the patients receive proper care, that it's quality care by the appropriate team members, and at the correct facility as well, in the correct unit. You don't want a patient that just had a back surgery, not to be in the correct unit. They need to be with nurses and physical therapists and stuff that know how to handle that patient and handle different like spine precautions and things like that. So kind of when I was researching about model of care, I came across the Massachusetts, always have a hard time saying that word, General Hospital, that kind of caught my eye, and some of their model of care concepts that I really agreed with. One is patient-centeredness. So this kind of goes along with what I was just saying. Having your visions and values, standards of practice. So making sure that everyone knows what their standards of practice are, and if they don't know them, how to access them. Having a narrative culture, encouraging that professional development, like I talked about before, difference for each person where they're wanting to develop as a professional healthcare member. Clinical recognition and advancement, so just recognizing people when they actually do meet their certifications, or they do get their bachelor's, or they get accepted into NP school, whatever it is that they're moving towards, that you're really encouraging that, and you're actually recognizing them for their achievements as well. Collaborative decision making, which we talked about that with my unit practice council, making sure that everybody's kind of involved in making the decisions for the unit. Research, so much of healthcare and especially nursing is based on evidence-based practice, and making sure that we stay up to date on research is very important, and best practices as well. And the last thing is innovation and teamwork are very important in a model of care. You got to be innovative. You got to be able to change with the things that are happening, and you've got to have teamwork, because nursing is not a one-person job. It's continual.
The 3 skills that you feel are most important for managers to use when leading an interdisciplinary team. To what extent do you possess these skills?
So 3 skills that I feel that are very important for a manager to utilize when leading an interdisciplinary team. So communication is very important. Motivation, and also the ability to delegation. So personally, I think that I have really good communication skills. I've kind of always seen myself as kind of a social butterfly. I'm pretty willing to go up and talk to anybody, and can kind of read people's mannerisms and know how they're responding to me or responding to a situation. So I'm able to not only read their, listen to their voice, but, watch their body language as well, and pay attention to their communication cues, and learn from them, and, respond appropriately to what's going on in that situation. So currently, like working as the rapid response nurse, I'm challenged daily with orchestrating communication between the primary nurse, the attending physician, and consulting physicians. Several times, You'll have the attending physician who may have done a surgery, but they consulted the hospitalist to cover for blood pressure management and blood sugar management, and then they might also have a palliative care consult. So, there's a lot of different teams and a lot of different hands in the pot. So orchestrating and talking with all those different team members and bringing them together, and even physical therapy and the respiratory therapist, making sure that I'm talking with them. And if the patient needs respiratory treatment or more respiratory support, making sure that I'm able to communicate with the respiratory therapist and with the nurse, the primary nurse. And I really do act as a resource for the primary nurse. Sometimes they'll feel concerned about a patient and they aren't quite sure what to do. They don't feel like it necessarily needs a rapid response because the patient's awake and talking and they're breathing okay, but they're concerned and they want me to come check them out. So I'm able to assess that patient and intervene as needed. So an example from just the other night, this patient had just received a new dialysis catheter, a tunnel catheter in their chest, and they called because the site was bleeding. And at first I was kind of like, well, a lot of times they kind of ooze and bleed, but when I went to actually assess the patient was in a puddle of blood, basically. So understandably, they were nervous, and we got the doctors involved and, did a chest x-ray and got some labs and stuff to make sure, if the patient needed blood, in which he did need blood. So, we got the ball rolling. So being able to communicate appropriately between all different interdisciplinary teams is very, very important. And then, sometimes a patient will be more critical, and I'll have to actually get our critical care team involved or get them moved to the ICU so that they can continue to receive care to get them better. Motivation is key at being an effective manager and leader. I kind of spoke about this earlier about really motivating your team or encouraging them and supporting them in their decisions to get new certificates or certifications or whatever it may be. So in order to have a cohesive, well-oiled team, members must feel that they're valued and encouraged and motivated. I kind of consider myself a little cheerleader. I love teaching different people, and I love teaching different nurses and working with the nurse aides and encouraging them and making them feel good about learning and making them feel confident, really, making them encouraged. A good manager is able to plan and assess tasks and able to organize them into categories. So the manager should be able to delegate tasks based on the importance and staff and make sure that staff members that they delegate them to are going to be able to complete these tasks. So they need to know their levels of their team members and know which team members they can delegate certain tasks to and which tasks are delegatable, what have to be able to prioritize them and make sure that they're delegating them appropriately so that they can be completed.
What management skills are you lacking?
Management skills am I lacking? So I'm developing as a leader and hopefully moving towards a management position. I feel like the one that I probably struggle with the most would be on the delegation side. Sometimes I feel like a little bit of a perfectionist, which I know is not possible. So I've definitely grown in that aspect of being able to step aside and not, oh, bless you, not take over, as much. But sometimes I do, I used to struggle with being able to step back and delegate tasks. And I've really been working hard on, not taking over a situation, actually trying to make sure that different team members have different things involved. So being the rapid response nurse has really, really encouraged that in me, because I walk into the room and they see me as kind of the leader. Okay, she's here to help, and she's here to fix the problem. So I have to kind of oversee everything and, ask this person to go do this, and this person to check the vitals, and this person to get a blood sugar, and this person to take the notes on the rapid response sheet. So they really look to me for that. So I've kind of stepped up into that. But it has been a little bit of a struggle for me, since I do kind of want to, I know that I'll do it correctly and I want to do everything correctly, but I have to I've started like really trusting my colleagues and knowing that they can and they will do the things if you set boundaries and specific instructions for them. So I've been challenged to manage the team, and just delegating the tasks, the procedures, and the patient care based on the circumstances. So like, it used to be like when a code blue would happen, I would run in. All I really wanted to do was chest compressions, because I knew I could focus on that one task and I was going to do that task correctly. And then it got to where, okay, I'm going to do the medications. But now I come in and I'm actually more of the timekeeper oftentimes, where I'm making sure that everybody's staying on task, letting the doctor know when it's okay to give epinephrine again, making sure that the compressions are done appropriately and that we're rotating people so that someone does not become fatigued. So I'm definitely stepping up my delegation game.
In what ways are planning and budgeting related? What factors would you consider when planning the budget?
Okay, that's a big one. So planning is basically the process for making arrangements and organizing activities to achieve a goal. You have to be able to formulate a strategy, implement it, and monitor that plan to ensure that it comes into fruition. Budgeting is having an estimate of your actual income and your actual expenses for a specific amount of time. So I know my unit actually does a fiscal year from May to May. So these two really do go hand in hand, because as a manager, most of the time you're going to be planning your budget a year in advance. You're going to look at a way to have your checks and balances to make sure that your budget works based on your plan. It's important to review past performances. So your last year, were there certain months that there were less surgeries that brought in less income for the unit, or was there a flux in staff members for whatever reason around the holidays, or kind of look at what happened last year and kind of formulate a plan within your budget to kind of see your changes and kind of have an expectation of what may actually happen. But then you also have to understand that there are some things that are just out of the manager's control that may have to go up to the administrators. You'd really need to review your organization's goals and projections for your actual unit. And the administrators really should have a good idea and understanding of the future plans for that unit, and should have the major items highlighted for that manager to be focused on. Variances should be reviewed to ensure that the causes and proposed corrective actions are actually in place. So you want to make sure that you have an idea of, if something happens, what your plan is, what your next step is to help balance that budget.
Right. Let's assume that you are hired into this position and that the budgeting process has already been in place by the previous manager. You notice that the budget does not include enough money to cover staffing for 3 months out of the fiscal year. What steps would you take?
That's a tough one. That would be really unfortunate for a unit to not to be able to pay their staff members that they're going to need for 3 months. So first I would look into whether this is an income problem that we have going on or a spending problem. And we definitely need to evaluate the issue, so if it's an expense problem, is there something that we can cut back on? Different supplies, different equipment, things that we could go without that could help cover those staff members. But if it's an income issue, then we need to try to find a way to either increase our income, and a lot of times that's not possible in a hospital setting. You can't really predict how many patients exactly you're going to have. I mean, you can try to have an idea of how many surgeries and what your positive income flux is going to be, but it can be difficult. But another way you could think about it would be, do we specifically need these staff members for those 3 months? Are we looking at true staffing based on demands? So, around the weekends, instead of staffing 7, could we go down to 5? Would that be possible? Would that allow us to save and be able to pay our employees appropriately? Are there certain days that they're like less staff is needed? Like I said, Saturday might be, they don't have surgeries on Saturday, so you might not have to have as many nurses. Could we have variations in start time or the length of shifts? So if we know surgeries don't start coming to our unit until 10 p.m. or 10 a.m., then, could we just have nurses that start at 10 a.m. and then left at 7 p.m. instead of having a 7 to 7 shift? Or if there is a lull in our patients, could we send nurses home early and give them the option of maybe using their PTO, they're using their PTO to cover their income. If there's less productivity going on, we won't need as many nurses to cover the unit. So it would be a sticky situation to kind of be in, but those are kind of my ideas on how to help bring and balance that loss of income there.
Describe your level of emotional intelligence. Give 2 examples of how your emotional intelligence has positively impacted a group or team.
So I feel that I've developed as a nurse, and I've realized that I really do have leadership skills, and I've acquired a high level of emotional intelligence. I'm optimistic and I'm positive. I feel like I adapt easily to change, especially in emergent situations. I have self-awareness, and I can recognize my own feelings, and I'm able to handle my emotions in situations and stressful situations, and be able to kind of gather myself and put them aside and come back to them later if needed. But I'm able to get a grasp on my own emotions and my own thoughts in a situation where I may not agree with what the family member wants or what the patient wants or what the doctor wants, but I have to set aside what my feelings are. And most importantly, I really think that I'm able to empathize really well with people. I'm able to understand their feelings and their needs, and it's key to do that as a successful leader. So to kind of give you an example of that, we had a patient that had a stroke, and she was actually in the neuroscience unit. And the nurse called me and was concerned. And when I got there, she was really struggling to breathe. And we did a head CT, and she was actually having an uncal herniation where her brain was swelling down into her brainstem. And the daughter wanted her to be a full code and wanted everything done, regardless of the doctor explaining, her brain will continue to herniate and eventually her drive to breathe will stop. So personally, I wanted the patient to be a DNR and to let her pass peacefully, but that's not what the family wanted, and that's not what the family needed at that time. So she, wasn't in agreement to letting her be a DNR or letting her be comfort care. So we had to validate her feelings, and we had to, just stand by her and encourage her and let her know we were doing everything we could to save her mother. And I was charge nurse that day, and I had to, really help the morale of the unit, to be honest with you, because it was really hard for everybody because, they see the patient as a person that they want to take care of, and if they could, they want to heal them. But they also see that person as being uncomfortable, and we want that person to be as comfortable as possible. But then we had to, like I said, empathize with the daughter, and really keep the team focused on taking care of the patient and the family at the same time. Eventually, the daughter did decide to make her mother a DNR, and we actually terminally extubated the patient, and all of the family was there with her to support the daughter and to support the mother. So they were all there when she passed. And the daughter came over to me and the nurse practitioner that night, and was just so thankful and so grateful that we were there and that we helped her through this hard time, and that we were able to not make her feel like she was making a bad decision, because she knew her mother wanted to live, and her mother wasn't. She was like 50, so she knew her mother really wanted to live, and she couldn't rest peacefully knowing that she gave up. So she wanted to try everything she could, and she was so grateful that we gave her that chance. Another time that I feel that my emotional intelligence really positively impacted my team was when we had another critically ill patient that we had to start ECMO on, which is kind of like a lung bypass, basically. And we don't really do ECMO at our hospital. We'll start it, and then we send them over to Duke, where they actually have the capability of managing that patient. And the primary nurse, Coleman, had never been involved with starting ECMO before, and no one else in the unit had as well. So I was the only one that had experienced it in our unit and kind of knew the process. So I look over at Coleman, and I can see him obviously getting flustered. He's kind of freaking out inside. I'm kind of reading his body language. He's really pacing, and he's not really knowing what to do. So I was able to step in to him, comfort him, boost his morale, and let him know that we were here with him. We were here to support him. We're going to be right here. I'm going to be right here if you need anything, or I can walk you through things if you have questions. We're all here working together. So the whole team was there to support him. He wasn't just there alone floundering, and I think that was a really big step for him. He really felt encouraged and felt, that we were there supporting him. So I was able to get him focused, and he was able to get the task accomplished, and the patient was safe, and the ECMO was started effectively, and the patient was transferred to Duke very quickly. So I think that was kind of an important moment for myself as well as for Coleman.
Is there anything else you feel would be important for me to know about your qualifications to lead and manage the med/surg?
So I would say that I'm driven, I'm motivated, I'm eager to step up into this management position. I've always enjoyed being a part of a team, and I've grown to see myself as an efficient and effective and accomplished leader. I look forward to being a part of your team, and I look forward to being the manager of your new med-surg floor. Thank you so much for the interview. I appreciate it.